Hi, my name is Dr. Igor Tabrizian. I'm a qualified medical doctor with a background in integrative and preventative health. On this channel, I'll explore evidence informed approaches to optimize well being from nutrition, gut health to hormones, energy, and everything in between. Please note, this information I share is general in nature and not intended to be used as medical advice. Always consult your own healthcare professional before making any changes to your health routine. Welcome to Histamine Part 1. Just as with serotonin and a whole heap of other neurotransmitters, there's a sweet spot for histamine. And I'm going to show you the reason why that is in today's lecture and give you an idea, a taster of how the body manages that in the different tissues that metabolize histamine. So there's a sweet spot for everything: blood pressure, blood glucose, sodium levels, temperature. This is very similar to mechanics where you want your engine coolant temperature to be in the middle. If it's too cold, the car doesn't run properly, and if it's overheating, the car doesn't run properly. Well, we're very similar and analogous to that situation. So that's the first thing I want to say, that all the neurotransmitters have a sweet spot. The second thing about them is they have more than one job. They have a day job, they have a night job, and it's important to understand that what goes on in the gut might not be the same as what goes on in the platelets, for instance. Another way to think about it is the central nervous system. Inside the central nervous system, the brain, spinal cord, these particular neurotransmitters have a function, but outside of that, they do something different, and histamine's no exception. One of the reasons that histamine keeps turning up is that in the understanding of why people get sick or why they fail to repair after an illness is a tapestry that runs through their story. And you often find histamine in that. So we can't really blame histamine, but we can blame the reasons why it's not where it should be, why it's not in the sweet spot. And I think it's important to understand the mechanisms of it. So, for instance, if we're trying to understand why somebody winds up with a disease, the fallout of something, the symptomatology, there's always something that preceded it. And if you're curious, and if your doctor's curious, they will go back and find out what was your genetic predisposition to this? What was the defense system that prevented triggers from setting off a chain reaction? And what are the ongoing factors that keep this inflammation alive to produce the fallout that you see today? And we're going to be touching on some of these things today. So, the total amount of histamine isn't one particular lever. It's a series of levers that might control the intake of histamine, the breakdown of histamine, the clearance of it by the liver, the uptake by the cells, the release of histamine from target tissues, and then the breakdown of histamine. So the total amount isn't necessarily one thing, it's a combination of things, sometimes in sequence, sometimes in parallel. And again, the reason for this is to keep it in the sweet spot for the different tissues. Now, one of the perhaps lesser known effects of the neurotransmitters is that they are immunomodulators. They are the levers on inflammation. And histamine in particular has two effects. It might be pro-inflammatory in some aspects, and it might be anti-inflammatory in some other aspects. It's important to understand this because if you drop people's histamine too low for too long, there are actually consequences. So don't sort of look at it as, oh, I've got a histamine problem and I have to suppress it long term. And I'm going to show you a very good reason why you shouldn't think like that. So, for instance, interleukin 8 is one of the cytokines that's released in response to a provocation. And the problem with interleukin 8 is the time frame for it, the cycle of it, is about 6 to 8 weeks. So histamine induces the interleukin-8 secretion by the endothelial cells. They're the cells lining the blood vessels. It's kind of the wallpaper of the blood vessels. But on the other hand, histamine suppresses the gene expression and synthesis of tumor necrosis factor. And that's one of the major cytokines that causes chronic diseases like rheumatoid arthritis. So there's two things going on here. The histamine might stimulate one type of inflammatory pathway, but it might actually reduce the production of pro-inflammatory cytokines. Now, here's a good reason why you shouldn't just suppress histamine willy-nilly long-term. Let's start with this. Histamine causes the nasal secretion of nitric oxide, particularly through the action of H1 receptors. We'll talk more about these in the nasal mucosa. So the nose makes nitric oxide, and it's particularly in the paranasal sinuses. So they are maxillary sinuses, ethmoid sinuses, those places. So why would it do that? Why is the nitric oxide produced there? Because when you're going to inhale that nitric oxide, it's going to go down into the lungs, into the heart. And in the heart, what it does is prevent calcium buildup in the coronary arteries. Now, that might seem a bit of a stretch, but there's an obscure journal called Nature, which has been around, I think, since 1869, that definitely shows that nitric oxide production in human paranasal sinuses. And that nitric oxide production is due to the histamine that causes the nasal secretions. So you probably remember you might have taken an antihistamine for allergic rhinitis or nasal congestion, but it's not something you want to do long term. Why? Because if you suppress the nitric oxide that's being produced, then you're going to get calcium buildup, and then you're going to see that you've got a high calcium score on your coronary angiogram. So it's the nose that makes the nitric oxide under the influence of histamine. So you can see here, this is another study from cardiovascular research from 2008, I think. Nitric oxide regulates vascular calcification by interfering with TGF-beta, which is another one of those cytokines. So you can see the histamine produces the nitric oxide. You inhale the nitric oxide, and the nitric oxide stops or inhibits calcium buildup in your coronary arteries. So in that situation, you can see the histamine is not the bad guy. And that's why you have to be very careful if you're going to go down the path of blaming histamine for everything, birth defects and your childhood anxiety and asthma. It's actually there for a reason, as long as we keep it in the sweet spot. All right, so how do we do that? So the normal histamine balance is a kind of a tussle between two things: the rate at which you produce it, or the rate of intake, and that includes dietary things that might stimulate histamine, and then the rate of breakdown. And the sweet spot for this will vary from person to person. For instance, there was a case of a mother and daughter who died from eating fish that contained high levels of histamine. And this disease is called scromboid. So fish, that wouldn't bother you so much unless you had asthma prior to that problem. And it's the same with peanut allergy anaphylaxis. The deaths were mostly from people with pre-existing asthma. So the total amount in that case, they ate fish unbeknownst to them that have high levels of histamine. They both had anaphylactic reactions and died. And that's such a problem that the World Health Organization monitors the number of scromboid cases for starters, but also monitors the histamine in the fish. So suddenly the intake can exceed your ability to break the histamine down. That doesn't happen very often, but you can see that there is a tipping point, a threshold at which these things will occur. So the control systems for histamine involve the intake of the dietary amines. So some foods create more histamine than others. But we have a defense system. We can break down those amines so that they're inoperable. You can block their uptake, or you can grab them so that they don't get absorbed completely. So there's a dietary aspect to this. The second thing is the digestive tract can control the amines the way, for instance, having enough stomach acid. Then we have the microbiome, and we know that there are some bacteria that are really famous for improving histamine. And one of them is Lactobacillus rhamnosus. Rhamnosus, which is quite a common strain for probiotics, reduces mast cell activation, decreases the release by the mast cells, enhances the gut barrier function, which helps the leakage of histamines across the intestinal wall into the bloodstream, and also promotes anti-inflammatory responses in case the histamine got away. So that's in the literature already. So you can see straight away that the microbiome can have a huge impact on histamine levels. And in fact, they're there to protect us from a lot of misadventures. But then everything that goes from the gut into the bloodstream winds up in the liver first. That's the liver's first port. It's the first port of call. And the liver controls the blood levels of histamine. And it does it using two enzymes. The one that converts histamine to N-methylhistamine, and the DAO enzyme. So that's within the liver itself. And there are genes that control the efficiency of this. Like some people are very efficient at destroying histamine. So in this situation here, we start with histidine, which is the neurotransmitter that gets converted to histamine. Then the histamine can be broken down through several ways. One through this enzyme, the shredder called MAOA, or another one called DAO, diamine oxidase. So we've got two ways of breaking it down. So the total amount, if you have efficient shredders, will never get to a point where you're going to have problems. If you look at Wikipedia, you'll see that there are 4 histamine receptors and they're spread out throughout the body. So, for instance, some of them are on the inside, in other words, the central nervous system, and some of them are on the outside in the periphery, and they do different things depending on which tissue, which location, etc. And we're still trying to scratch out a bit more information about what histamine actually does and why it's important to keep it in the sweet spot. So there'll be more about this in the next lecture on histamine. I'm glad you were able to watch, and I'll talk to you then.